Good morning, everyone. Welcome to the webinar on strengthening actions to protect children from the harmful impact of food marketing in the Western Pacific region. Good day. Thank you for joining us today from different time zones and different parts of the world. My name is Xi Yin. I'm the coordinator for NCD prevention and health promotion in the Division of Healthy Environments and Populations of the WHO Western Pacific Regional Office. I oversee programs tackling NCD risk factors, including unhealthy diet. We're very excited to bring you today's webinar. Over the next 90 minutes, we will be discussing available evidence, highlight available guidance and resources from WHO to protect children from the harmful impact of food marketing. Also, we're very thrilled today to take this opportunity to share with you a preview of the operational menu for the Regional Action Framework on protecting children from the harmful impact of food marketing in the Western Pacific. The manual offers member states step-by-step guidance on implementing the framework's policy actions. More importantly, we are delighted to have representatives from a few countries in our region to share their experiences in this very important area of work. Throughout the webinar, we welcome and encourage you to raise questions in the Q&A box. The speakers and experts will try to address them there in the box or in the plenary if time allows. The marketing of breast milk substitute and food high in saturated fats, trans fatty acids, free sugars, or salt continue to widespread across the Western Pacific region. We hope this webinar will further support policymakers and stakeholders in our region to strengthen efforts to protect children from this harmful impact of food marketing. Without further ado, let me first welcome Dr. Hiro Okuyasu, our Director of the Division of Healthy Environments and Populations at WHO Regional Office for the Western Pacific, to open this webinar. Dr. Hiro, the floor is yours. Thank you.
Thank you very much. A very warm welcome to all our distinguished speakers and participants, government representatives, partners, civil society organizations, academia, and colleagues. Good morning and good afternoon. It is my great pleasure to open this very important webinar, Strengthening Action to Protect Children from the harmful impact of food marketing in the Western Pacific. Your presence and participation today reflects our shared commitment to safeguard to the health, nutrition, and well-being of our children. In our region, we face a very significant double burden of malnutrition. In 2024, an estimated 8.4 million children under 5 are stunted, while 8 million were overweight. Amongst children and adolescents aged 5 to 19 years, overweight and obesity now have surpassed thinness. Exclusive breastfeeding remains suboptimal, with prevalence at 38%, the second lowest among all WHO regions. One major driver of these challenges is pervasive and pervasive food marketing. The promotion of breast milk substitute undermines breastfeeding, and then marketing of food high in saturated and then trans fat, free sugars, and then salt distorts healthy dietary choices. This marketing not only harms nutrition but also infringes on children's right, their right to health, to nutritious food, and then to protection from exploitation. Back in 2019, member states endorsed the Regional Action Framework on protecting children from the harmful impact of food marketing. This year, 2025, marks the midpoint of its implementation. The framework is anchored in long-term planning and contributes directly to the 2030 Sustainable Development Goals, particularly eliminating all forms of malnutrition and reducing premature death from non-communicable diseases. This help countries to put regional action framework into practice. WHO, working with our collaborating center, has been developing an operational manual that offers concrete guidance, tools, and examples. Today, you will have a first look at this manual, which we hope to officially launch in the coming days. You will also hear from some experts today to discuss the evidence on food marketing to children and caregivers, as well as representatives from Fiji, Mongolia, and Singapore, who will share their experiences and lessons learned, giving us valuable insight into how countries are translating commitments into real-world action. In concluding, we need stronger and more coordinated action to protect children from harmful food marketing, whether from breast milk substitutes or unhealthy food and beverages. Thank you very much once again for your participation. I wish you a productive and inspiring session today. Over to you.
Thank you, Dr. Hiro, for setting the stage for us. So let me now invite our first speaker of the day, Professor Catherine Backholer. Catherine is a professor and co-director of the Global Center for Preventive Health and Nutrition at Deakin University, a WHO collaborating center for obesity prevention. Her research aims to bridge policy and practice knowledge gaps for the prevention of non-communicable diseases, with a focus on protecting children from unhealthy marketing, particularly in the digital ecosystem. Professor, now you're ready. You may start when you're ready. Can we enable the sharing slide? Okay, great. Catherine, go ahead.
Thank you very much. You can see my slides. Are they okay? There?
Yes.
Okay, great. Thank you very much for asking me to speak in this webinar today. It's such an important topic, and it's a real privilege to be here. So I'm coming from Melbourne, Australia, and I'm here today to talk about the pervasive and influential food marketing in the Western Pacific region. So we know that good nutrition is fundamental to health at every stage of life. The first 1,000 days from conception to a child's second birthday lay the foundation for lifelong health and well-being. Exclusive breastfeeding for the first 6 months is one of the most effective interventions we have. It protects against infections, supports healthy growth, and reduces the risk of obesity and other non-communicable diseases later in life. Yet in the Western Pacific region, and certainly in many countries right around the world, fewer than half of infants are exclusively breastfed for the first 6 months. And then as children grow, access to safe, affordable, and nutritious foods is absolutely essential for the development of health and learning. But too often, these foods are displaced by energy-dense, nutrient-poor snacks, sugary drinks, and the like. So right across the life course, whether it be from infancy all the way through to adolescence, we know that nutrition is absolutely critical to health. But at the same time, increasingly children's diets are not defined by what is healthiest, but what is marketed most aggressively. So how does this play out across childhood? In infancy, the aggressive promotion of breast milk substitutes to parents and caregivers. By early childhood, supermarkets and retail spaces are filled with promotions, cartoon mascots on highly processed foods, and brand sponsorship of sports and entertainment. And then by adolescence, the digital world really takes over algorithms, influencers, and immersive online platforms delivering highly targeted, personalized marketing straight to digital devices. And the evidence is really clear. We have a number of systematic reviews that the WHO has commissioned over the past few years that shows the marketing of breast milk substitutes and food increases brand awareness, preferences for certain brands and products, loyalty. It increases purchase requests of marketed products, and then consumption. So despite the International Code of Marketing of Breast Milk Substitutes being in place for over 40 years, and the fact that many countries have at least some regulations in place for the marketing of breast milk substitutes, we know that companies continue to find ways to bypass or simply ignore the rules. So traditionally, they've played on parental anxieties and eroded confidence in breastfeeding through misleading health claims or labels, having idolized imagery of happy, thriving babies on formula, and direct marketing through health professionals such as free samples in hospitals or sponsorship of medical conferences. But over time, these approaches have been supercharged by more insidious strategies, and I want to focus on these in my talk today. So whether it be cross-promotion, so this is where toddler milks are packaged to look almost identical to infant formula. So the toddler milks have the same logo, colors, even mascots. And what this does is it blurs the line between products and creates a seamless brand recognition from infant formula through to toddler milks. It also creates regulatory loopholes. So we know that most countries around the world, when they do have rules and regulations in place, it's focused on infant formula, so 0 to 12 months. And companies can then legally advertise toddler milks, but with the same imagery, the same messaging, which is effectively promoting infant formula by proxy. It also creates health halos whereby ads for toddler milks claim benefits like brain development, immunity, or growth support. And then parents unconsciously transfer these claims to the company's infant formula. So this is cross promotion. And then increasingly, these tactics are shifting to the digital space. So we know companies now weave formula brands into social media and influencer content. They're using artificial intelligence to personalize and also integrate marketing into everyday life. And I'll show you a few examples of how the formula industry is doing this a little later. Similarly, when we think of junk food marketing to children, it used to be that what came to mind was brightly colored cereal boxes with cartoon mascots or TV ads or toys within fast food meals at fast food restaurants. So obviously these tactics are still around, but the food industry, again, has become much more sophisticated and is now embedding itself into children's lives into ways that are harder to detect and even harder to regulate. So again, I'm going to draw your attention to some of those more newer ways of marketing. So I'll start with integrated marketing. So this is where children no longer see ads in isolation. They encounter brands right across many touch points in their lives, whether they see it first, a brand or a product on a sport team jersey. They then go on YouTube and see it in a video, and then they go to the supermarket and that product and brand is at eye level at the supermarket. So these exposures are reinforcing each other, and companies are doing this on purpose so that they're constantly touching children as they go about their daily lives. The second is brand marketing. And this is where a company will market its brand, but not a product. And this is because companies know that children don't just buy products, they buy whole identities which are connected to brands, whether that be a brand that's associated with fun, friendship, sport, or even sometimes health. It's all about creating these emotional connections. And then what's important here is as we see governments starting to crack down on junk food marketing, everywhere around the world, brand marketing is exempt. So brands can still put their logos up as long as there's not an unhealthy product in it. And I think we'll see more and more of this brand marketing in the future as we do start to see countries acting on product marketing for unhealthy foods. The next tactic is targeting parents. So for example, we're seeing increasing number of marketing strategies targeting parents with, for example, sugary snacks, which are packaged as school ready, or including claims about convenience and nutrition. And then lastly, again, digital marketing and artificial intelligence. And this is where I'll spend the last half of my talk. So the reason why I want to focus on digital marketing is because it's perceived or it's shown to be much more impactful than conventional forms of marketing. And this is because we know that the impact of marketing is a function of exposure, so how much you see, and the power of that marketing, so how much that marketing messages draws you in and engages you. And all of this is elevated in the digital environment. So starting with exposure, we know that across the Western Pacific, kids are spending upwards of 2 hours per day online, with some countries upwards of 6 hours every day online. So huge potential for exposure. We know that messages are shared virally across the internet, and marketing messages are delivered in hyper-targeted ways through algorithmic targeting. And all of this elevates exposure. When it comes to power, marketing messages are algorithmically personalized. So for a given campaign, what you see and what I see can be completely different based on the data underpinning our online profile. The marketing messages are much more immersive, pulling people into the marketing experience and asking them to engage with that marketing content, and then increasingly shared by trusted users, whether that be peers or influencers. So it's not surprising that food companies right around the world are spending more and more on marketing their products through digital media. Here I have the global food advertising spend on social media, and you can see between 2016 and 2019, we saw a progressive increase in marketing spend on social media. And then surprise, surprise, when we're all locked down during COVID, a huge jump in 2020, which has remained elevated ever since. So I'm going to finish the last part of my talk just showing you some examples of marketing campaigns to illustrate what I've talked about today. So these are both bought by formula companies and food companies. And so the examples I show you have come from an industry database. They're of award-winning marketing campaigns. So when I present these, I'm using the language that's come directly from industry, the way that they're describing their marketing campaigns. So the first one is from a large formula brand in Singapore. And what this brand recognized was that during COVID, with events, supermarkets and exhibitions cancelled, they needed to switch from traditional marketing to some way of hyper-targeted marketing outreach. So what did they do? They created a marketing campaign which centered around mothers sharing what they called honest experiences with other mothers. They partnered with Singapore's biggest parenting platform that has access to more than 80% of parents and recruited what they called mum ambassadors. So these were ordinary mothers that they recruited to be part of this campaign, not influenced, just everyday mothers, to then deliver free formula door to door to mothers in Singapore. And then but with the campaign, they amplified it via WhatsApp, closed Facebook groups and Instagram. They leveraged trusted peer-to-peer networks. They encouraged parents to share photos, reviews, and experiences online and created viral user-generated endorsements. The impact, they said, well, it showed it had 6.1 million impressions. In other words, it was available to be seen more than 6.1 million times online. 85% of new signups were mothers who had never used infant formula before, and 250% re-engagement of mothers through the campaign, meaning they connected with the campaign more than once. So this campaign is really a textbook example of how formula companies exploit community trust, peer networks, and digital platforms, which starts to blur the line between genuine support and corporate marketing to get mothers to use their products. The next case is from Malaysia. So this sugary drink brand identified, in their own words, that plain milk was the main beverage being consumed by children at breakfast time. And so they set out on a marketing campaign to shift the market where they explicitly say, in the write-up of their campaign, they explicitly say they wanted to stop kids from drinking milk at breakfast and instead get them to start drinking their sugary drink brand. So their strategy was to reframe breakfast as an energy need. So not just for nutrition, but also as a need to build energy for the day. And then position their beverage as the fuel that kids need for a long, demanding day at school. They launched their marketing campaign on TV, social media, and also included on-ground events where children play sport, where they spread the message that a school day was equivalent to an endurance sport. In terms of impact, they saw a 20% uplift in the association of this drink with breakfast. And as they say, they stole the share from the milk industry. They went from 47% of that share of beverage for breakfast up to 52%. This one's from the Philippines now, where this fast food company recognized that Christmas, being the most popular, being a big season in the Philippines, it was a good time to hook consumers to their brands and product. So what they did is they introduced a Christmas meal and created a mobile game for people to use, and then boosted that campaign across all the different online channels. So I show you this one because it's an example of gamification. So creating a game that users can engage with and then prompting them to buy their product at the end. In terms of the impact, what they saw was a strong ad recall, with over half those that they survey recalling the ad. And 92%, so a huge percentage, 92% of those exposed to the campaign took action by visiting this quick service restaurant afterwards, or ordering by delivery, online delivery afterwards. And then the last one I'll show you is a study which shows the integration of both the online and offline environments. So this one is a formula company in China who recognized that local Chinese formula brands struggled to regain trust after food safety issues. So they set out to strengthen its image as the infant nutrition expert among young tech-savvy parents. So the formula company partnered with a smart speaker brand to embed what they called was an AI baby expert. And it had more than 1,000 question and answers embedded into the speaker related to infant feeding, sleep, and health. So this AI baby expert was marketed to parents everywhere on all the online channels. And then speakers were given out as gifts when parents purchased more than a month's supply of this milk powder. And then when parents engaged with the speaker, every time the speaker responded with an answer, it also mentioned this particular brand. In terms of impact, what they found was 55 million question and answers interactions occurred with the speakers. 60% of the speaker owners engaged with the tool, and they gave out all 10,000 gift sets of the speaker, meaning that those people bought a month's supply of the formula to get this free speaker. I put this example up because I think it's a really prominent example of how these companies are just embedding themselves into everyday lives, and it's no longer just our digital media, just our online devices, and just our offline environments, but really integrated across the two. So I'll just wrap up by saying we know that self-regulation doesn't work. We've had reviews that show that government-led regulation is always much more effective. And certainly here in Australia, we've had a review of our self-regulatory system for marketing of infant formula, which was deemed not fit for purpose. And the government here has agreed to legislating the marketing of infant formula. And this is exactly why countries across the Western Pacific region signed up to the Regional Action Framework on protecting children from the harmful impact of food marketing, and why we're all here today. So just to sum up, aggressive marketing of breast milk substitutes and unhealthy foods undermines children's health and well-being. The marketing of breast milk substitutes and unhealthy foods drives brand loyalty, preference, and purchases of marketed products and brands. The formula industry and food industry are using traditional but also much newer media to market their products throughout the Western Pacific region and integrate themselves into children's and families' lives. And I think digital marketing and the use of AI is a particular concern and something we really need to stay on the front foot with. And then finally, protecting children's health requires government action to restrict breast milk substitutes and unhealthy food marketing across all media and settings, not just in isolation. So I will leave it there. Thank you for having me, and I look forward to the rest of this discussion today. Thank you.
That's great. Thank you, Catherine, so much. So from your presentation, really the exposure, power, and impact of food marketing, and especially with the formula and food industry's newer techniques of using extremely targeted strategy in the digital media is really, really worrisome. So it's a reminder for all of us to take urgent action right now to protect children from harmful effect of marketing, food marketing. So again, Catherine, thank you so much. And if you don't mind staying with us until the end of the session, we have a small, short open discussion. We'll be really grateful. So now let's move on to the next speaker, mindful of time. So next, I'm very delighted to invite our HQ colleagues, but unfortunately, due to the time difference, she will not be able to join us live. But she has kindly sent a recording of her presentation. So let's welcome Dr. Katrin Egelhardt, who will walk us through WHO global guidance on protecting children from the harmful impact of food marketing. So just a really brief introduction of Dr. Katrin. Katrin is a scientist at the WHO headquarters in Geneva, leading global work on food environment policies, including labeling, marketing, school nutrition, and the links between climate and nutrition. She previously coordinated the region's, actually the Western Pacific Regional Nutrition Program, aimed at advancing policies to tackle the double burden of malnutrition and strengthening health promotion in countries. So now let's play Katrin's recording, please. Just give us a second to get the audio back. Okay, colleagues, we'll come back to this one. So we'll move to the next one, mindful of everyone's valuable time. So you have heard from Dr. Hiro in the beginning. 6 years ago, member states endorsed the Regional Action Framework to protect children from the harmful impact of food marketing. This framework represents a concrete regional commitment by our member states to update national plans and strengthen actions to protect children from the harmful impact of food marketing. So let me hand over to my colleague, Dr. William Ng, our nutrition consultant at the Western Pacific Regional Office. He will spend the next 5 minutes to walk us through the regional nutrition landscape and food marketing policy progress. William supports WIPRO's nutrition work plans to address the double burden of malnutrition and promote healthy diet. Without further ado, William, please.
Thanks, Steve. Yep. Good day, everyone. I will be presenting the presentations empowering the actions, implementing the RAF. The outline of my presentation is as shown on the slide. So in the Western Pacific region, there are about 8.4 million of stunting among children under 5. And on the other hand, there are 8 million of overweight in this age group, as you have heard from our Dr. Hiro. And it is really showing that double burden of malnutrition is still prevalent in our Western Pacific region. In every 5 children and adolescents aged 5 to 19 years old, there will be one of having issues of overweight. Among the mothers, 2 in 5 mothers will practice exclusive breastfeeding. Alarmingly, as you can see from the line graph, it is alarming to see that the overweight is increasing among the age of under 5 and also between children and adolescents between 5 to 19 years old. Based on available country data in the Western Pacific regions, the economic impact of overweight and obesity is estimated to be reaching USD 11.3 trillion by the year of 2060 if there is no intervention. Total cost as percentage of GDP range from 2% and to as high as 12% if there is no intervention. This slide summarizes to you the regional policy progress. Today, we are particularly interested to look at 2 policies which are considered NCD best buy. 1, marketing of breast milk substitute, BMS restriction. Out of the 28 countries in the Western Pacific regions, we have 6 countries labeled as fully achieved, which means they have policy that is substantially aligned with the international code for BMS. On the other hand, for marketing to children's restrictions, we are looking at food high in saturated fat, trans fatty acid, free sugar, or salts. We have 9 countries that label as fully achieved, which means they have practiced mandatory approach. And in addition, there are another 4 countries that have partially achieved, which means they have voluntary approach in restricting marketing in this area. To recap, the Regional Action Framework on Protecting Children from the Harmful Impact of Food Marketing in the Western Pacific, initiated in the year of 2017, where member states expressed concern on the food marketing and requested to develop the RAF. With discussions of RAF with the experts, member state and key stakeholders in year 2019 at the 17th of RCM, member state endorsed the RAF. The timeline of implementation is between 2020 and 2030. The product covers food high in saturated fat, trans fatty acid, free sugar or salt, and also breast milk substitute. In the resolution approved by the member state, there are requests to the regional director to provide technical support to implement the RAF, to facilitate dialogues and exchange of experience, and also to report periodically on this RAF. So to strengthen and further guide member states to operationalize the RAF, the idea, yeah, thanks. Sorry for the slide. Okay, the ideas of developing operational manual conceptualized and later contracted to University of Wollongong, Australia, which we will be listening from Prof. Bridget Kelly a later while. So this University of Wollongong, Australia became one of our WHOCC. The purpose of operational manual is to guide users and let them understand the issue and challenges around regulating food marketing. It enhances the awareness and skill on various policy stages and what can be taken, and assists officials to formulate and adopt policies and plan policy communication and monitoring and evaluation framework. This is a tool or manual to provide practical tools to support implementation for the target audience, including technical staff, program manager, policymaker, and advocates. With this, I would like to end my presentation by acknowledging those that have contributed in the development of the operational manual. Thank you for listening. Over to you, C.
Thank you so much, William, for that very concise overview where we are today. Now, it is with my great pleasure that I invite Professor Bridget Kelly, our WHO Collaborating Center for Children's Food Nutrition and Physical Activity, to share with us a preview of the draft operational manual for the Regional Action Framework on protecting children from the harmful impact of food marketing in the Western Pacific. It's a long name, I know. So Professor Bridget worked with the WHO Western Pacific Regional Office closely in developing the operational manual. Bridget Kelly is a dietitian and a professor of public health nutrition at the University of Wollongong and a global leader in food marketing and labeling. Her research has shaped national and international policy, advanced capacity building, and supported WHO and UNICEF for over a decade. She is an inaugural member of the infamous consortium, and since 2022 leads a WHO Collaborating Center on children's food, nutrition, and physical activity. So now let's enable the slide sharing for Professor Bridget Kelly. Bridget, please. Thank you.
Thank you. Can I confirm you can see my slides okay?
Yes, perfect.
Okay, thank you. So I have the pleasure of introducing this operational manual that accompanies the Regional Action Framework to protect children from the harmful impact of marketing in the Western Pacific. As she mentioned, I've been involved in the development of this manual, along with Catherine and William, who we've just heard from. So in this brief presentation, I will give an overview of the manual, and I'll also introduce some of the country case studies which are included in the manual, but we're going to be hearing more about those in the next session. So this figure here depicts the Regional Action Framework that we've seen and is the basis for the operational manual. It outlines the policy objectives and the guiding principles, and importantly, the recommended actions for establishing or strengthening policies and actions to protect children from the harmful impacts of food marketing. And these actions are arranged into pillars, which relate to the policy framework, multi-sectoral and multi-stakeholder collaboration, advocacy and communication, and monitoring and evaluation. And the operational manual that we're introducing now recognizes that actions across these pillars are not sequential, but rather they're interrelated. The structure of the manual details the recommended actions across and within those pillars of action that I've just mentioned that should be considered in the context of the stage of policy progress for a country. For each stage of the policy cycle, member states should decide on the necessary sequence of actions to progress food marketing policy based on the national context. And the manual supports this identification of those actions or those priority actions by outlining the actions to be considered, the practical considerations to guide understanding of the discrete activities, case studies from the Western Pacific region to illustrate experiences, and many templates and examples to support adoption. Now, this is a busy slide just to show you the breadth of information that's included in the manual, and I will break this down into some smaller sections in a moment, so please don't be overwhelmed. This is really just to show that those 10 recommended actions are shown on the left-hand blue columns, and then the colored arrow boxes show the corresponding practical considerations. Some of those are unique for a particular stage of the policy cycle, while others repeat and develop across the different stages. So, for example, the use of evidence is important for advocating for policy action and enforcement at all stages, but the types of evidence and its application evolve throughout that policy cycle. So I will now give an overview of each pillar, the recommended actions to undertake, and the practical considerations as separated by policy stage. So first, the policy framework pillar, under which there are 2 recommended actions related to establishing or strengthening the legal and regulatory framework and enforcement and compliance mechanisms. The practical considerations change depending on the stage of policy progress. So at the agenda setting stage, activities relate to defining the issues with the existing policies that are in place in the country. At the policy formulation stage, activities relate to setting the scope of the policy, drafting the policy, identifying the agencies responsible for policy enforcement, and defining sanctions. At the policy implementation stage, activities relate to identifying the agencies responsible for the policy and their capacity for implementation. And lastly, at the review stage, activities relate to, again, reviewing existing policies with the intent of further strengthening those policies. And allocating resources is applicable across all policy stages. Just to show an example of some of the details that underpins these practical considerations. So here is the activity relating to defining the issues, which is part of the action on establishing or strengthening the legal and regulatory framework. So for all of the activities or practical considerations, the manual guides users on the applicable policy stage. Here, this relates to conducting a situational analysis of the policy context to identify the issues and gaps and compare the existing policies that aim to reduce marketing exposure or power or impact to WHO policy guidance. To accompany this activity, there are case studies to describe how the activity has been used in Western Pacific member states to progress food marketing policies. And there are also templates for appraising food marketing policies And these tools capture details on the available policies and guides the assessment of policy components. It uses, as you can see down the side, a traffic light system to identify and clearly communicate aspects of the policies that require strengthening. And the outcome of this process is a policy dashboard that shows the strengths and the weaknesses of current policies.
15, maybe 14, 15.
Next is the multi-sectoral and multi-stakeholder pillar.
In some ways.
Again,
in some
there are
ways, it's
two actions that are relevant here related to ensuring policy coherence across government and defining multi-sectoral and multi-stakeholder actions. Again, the practical considerations change depending on the policy stage. At the agenda setting stage, activities relate to nominating the lead government agency and mapping cross-ministry perspectives to ensure policy coherence. At the policy formulation stage, activities relate to establishing government coordination of the policy and the lead agency to oversee the policy. And these activities are also relevant to the policy implementation stage and the policy review stage. So that includes things such as managing conflicts of interest, identifying and clearly defining the roles of stakeholders and sectors, and engaging non-stake stakeholders across all of those policy stages. So as another example of just one of the practical considerations in this section, this activity relates to managing conflicts of interest, which is part of the actions on ensuring policy coherence across government sectors. As you can see, that is relevant to all stages of the policy cycle. And this activity relates to conducting due diligence on any potential partner who may be involved in policy processes and carrying out appropriate mitigation procedures if a potential conflict is identified, including applying conditional participation or partial exclusion from policy processes. To accompany this activity, there is detailed information on WHO guidance and tools for managing conflicts of interest. Thirdly, the advocacy and communication pillar, under which there are 3 recommended actions related to advocating for policy action and enforcement, raising public awareness of the need for policy change, and facilitating civil society participation. At the agenda setting stage, activities relate to identifying the policy frame, which is the way that the policy issues can be conveyed. Other relevant activities across the different policy stages include using the evidence to underpin communication and advocacy, supporting community-based coalitions, and developing a communications plan, as well as conducting mass media campaigns, engaging in reform efforts, and providing capacity building. One example, again, of a practical consideration under this section is the development of a communications plan, and this is part of raising public awareness of the need for the policy. To accompany this activity, there is guidance and an example plan that is given, which outlines information on the strategy for the communication plan, responsible agencies, target audiences, activities, and key messages. So you can see the level of detail that the operational manual includes to provide guidance to member states. Lastly is the monitoring and evaluation pillar, which is underpinned by 3 actions relating to undertaking a situational analysis of the context, building evidence on the effectiveness of policy actions, and designing and implementing a monitoring and evaluation framework. At the agenda setting stage, activities relate to conducting a situational analysis, defining key indicators of success, considering research and related capacity, and comparing policy progress. These activities are also relevant to the policy review stage. At the policy formulation and review stages, activities relate to evaluating policy impact and effectiveness, and introducing reporting obligations, which are then executed during the policy implementation stage. And common activities across policy stages here relate to considering resources and establishing compliance monitoring. So another example of an activity under this pillar is establishing compliance monitoring. And this activity is relevant throughout policy formulation, implementation, and review. And it relates to establishing effective, objective, and independent monitoring systems and integrating these into the food marketing policy framework. To accompany this activity, there are case studies from member states to give examples of how this has been actioned, and a logic model and template for developing a monitoring and evaluation framework, which includes monitoring of policy implementation and compliance. So I'm sure throughout my quick overview of the manual, you can get the sense of the detailed information and guidance that is provided in the operational manual. This slide just lists the tools that are given as annexes in the report to support the manual's adoption by member states, including by policymakers, policy implementers, civil society organizations, and academics. Lastly, I would just like to introduce a separate online training course that we have developed as part of our collaborating center at the University of Wollongong to further support member states to achieve progress and policy, and which is aligned with the WHO Regional Action Framework and the operational manual that underpins that. This course is currently not available, but will be released as an open access course to anyone who is interested through an open learning platform once the operational manual is available. The training is closely aligned, as I've said, with the operational manual. It includes a series of training modules that directs participants through a discussion of the problem, recommended solutions, and actions to progress policies. And participants conduct a guided assessment of their country's relevant food marketing policies to identify priority action areas. And you can see a screenshot here of some of the modules and their components. The training course will be made available through the University of Wollongong's WHO Collaborating Centre's landing page after the release of the operational manual. Thank you, and good luck with policy progress.
Thank you, Professor Bridget, for presenting the draft operational manual. As you have clearly stated, it offers countries clear pillars, actions, and tools they can adapt for their local context and illustrate how these fit into different stages of the policy process through real country case studies. I want to take the opportunity to thank the governments and WHO country offices for providing and facilitating the inclusion of these case studies featured in the operational manual. So, and then of course the framework. So now for participants, we invite your thoughts, reflections, and questions using our Q&A box. And once again, Bridget, thank you so much for your invaluable contribution to the development of this operational manual. Do we have questions in the Q&A? So, okay, so we can, again, if you can stay with us towards the end of the session, we have a small open session, open discussion. Okay, now let's hear from countries. How did they or still are overcoming challenges to regulate food marketing? First, it's my honor to introduce our Fiji representative, Mrs. Ateta Kama, to deliver the topic titled Leadership to Ensure Policy Coherence Within the Government Sector and Strengthen Multi-Stakeholder Collaboration to Restrict Breast Milk Substitute Marketing. Ms. Kama, the floor is yours. Thank you. We'll share your slides.
Good evening, colleagues and friends. I thank WHO for the invitation to be part of this webinar. And I'm most humbled to share Fiji's experience regarding what has happened in the marketing restriction space for breast milk substitutes in Fiji. So can I have the first slide, please? I thought I'd present the MANA dashboard update. MANA is the Monitoring Alliance for NCD action in the region. And so this Pacific MANA regional dashboard is on the scaling up of the implementation of regional commitments and national priorities. So for the marketing of breast milk substitutes, which is part of the health system responses that Fiji had provided after our last assessment in 2024. So there is a government regulation that is in place. And for Fiji, we call it the Marketing Controls, Foods for Infants and Young Children. The regulation bans all forms of advertising and promotion of breast milk substitutes to mothers and the general public. And it's regulated under the Food Safety Act to promote breastfeeding and ensure safe and adequate nutrition for infants and young children. So currently, Fiji sits at 2 stars after we initially began with 3 stars. This is due to the repealing of Part 4 on labeling. However, Fiji is working really hard, working with development partners and the Solicitor General's Office to reinstate Part 4. Can I have the next slide, please? So this has been our progress so far. We enjoy a very strong and supportive leadership in Fiji, beginning with our Honorable Minister and the Permanent Secretary, and as well as other government ministries that have been engaged through the consultative processes to having a very strong legal framework. As I had mentioned, Fiji's code encompasses all aspects of the law, and what has also helped with the implementation of these marketing controls is the baby-friendly hospital initiative programs and activities happening in Fiji. Fiji was declared a baby-friendly nation way back in the early 2000s, but we still need a lot of work in that space as well. Maternity and workplace support policies. This has also been included as part of our workplace policy. So that has also synergized with having a strong legal framework in place. And just to quote here from one of our former consultant pediatrician, in how having the marketing controls in place has also empowered our health workers, in that nurses have become much more friendlier and are smiling more. Can I have the next slide, please? Can I have the next slide, please? So these are some of the barriers that we have encountered during our journey to having this regulation in place, and as well as implementation. And I'm sure some of these barriers are similar across the region. So the power of social media, for instance, which includes the effects of indirect promotion, corporate power, their influence in terms of sponsorships and partnerships, and also public perception and misinformation through perceived convenience resulting from aggressive marketing tactics. Lack of maternity support, both at home and at workplaces. Mothers are expected to continue working the farms in some parts of rural Fiji, while there's a lack of baby crashes, maternity leave policies in some corporate organizations, and as well as the lack of breastfeeding friendly infrastructure at work. There's always social and cultural norms associated with infant feeding practices, such as weaning, prelactal feeds, and also lack of support. And sometimes what is deemed to be a medical necessity in terms of top-up milk, this also undermines the effort to promote exclusive breastfeeding and with the support of the law in place. In terms of mother's choice, despite all the efforts, all the counseling, some of our mothers in Fiji still choose to bottle feed their baby. And of course, there's lack of training of healthcare professionals, lack of enforcement from the custodians. Our environmental health officers are the custodian of the law. Because of staff turnover, these officers have not been trained, and we also see a lack of unity in the region as a barrier. Fiji is the hub of the Pacific, and it exports throughout the region. So if our other Pacific Island countries are able to also ratify the regulation or the law for the code, we should be able to present a regional front. And of course, barrier to part 4, as I had mentioned, of our regulation that has been repealed. Can I have the next slide, please? This is a way forward. This is also my last slide. Right now, with support from the Secretariat of the Pacific Community, we are developing a policy paper for cabinet approval to reinstate Part 4 of the regulation. We also envisage training for health staff once we receive cabinet approval. Not only the professional health staff in our health facilities, the training is to also involve our community health workers. Health promoting workplaces. Right now in Fiji, there's a TOT being conducted for health promoting workplaces, and the inclusion of the marketing controls is part of this training that is being offered to our health workers. There are also efforts to work on the maternity leave policies to extend. Right now, Fiji enjoys 3 months maternity leave, and there are efforts to increase the 3 months to 6 months maternity leave. That's also work in progress. And of course, to strengthen the monitoring and enforcement through authorized officers. Fiji is also looking at having other cadre of professional health staff, apart from environmental health officers, to be authorized officers so that they can also monitor the marketing controls, food for infants and young children. I appreciate your listening in today, and I look forward to the Q&A session afterwards. Renaka.
Renaka, Mrs. Atate, thank you so much for your presentation. I forgot to introduce you properly before your presentation, but just want to highlight that you have become with over 30 years of service at the Ministry of Health as a chief dietitian and nutritionist. So thank you again, and we wish you all the best and your colleagues all the best with the work on the policy paper, engagement with community health workers, and all the other very, very important work you're doing. Thank you so much. Again, I invite the participants to post your questions in the Q&A box, and we will address it towards the end of the session. So now, let us now go to Mongolia. For the country experience sharing, Mongolia has taken steps to regulate the marketing of breast milk substitute and unhealthy foods in schools. Joining us today is Dr. Lam Erdine Biambadu. The title of her presentation is A Government-Led Mandatory Policy Framework to Protect Children from the Harmful Impact of Food Marketing. Dr. Biambadu, the floor is yours.
Good, thank you.
Oh, wait, sorry. Let me introduce you briefly. Dr. Biambadu is a senior expert at the Department of Public Health Policy, Ministry of Health of Mongolia, overseeing NCD control, prevention, and screening. She has been actively engaged in national efforts to address non-communicable diseases since 2020. Now, Doctor, the floor is yours. Thank you.
Okay, thank you for the introduction. So good morning, everyone. Today I will present Mongolia's experience with the government-led mandatory policy framework designed to protect children from the harmful impacts of food marketing. So the childhood obesity and unhealthy diets are rising in Mongolia, not only in Mongolia and also worldwide. The marketing of the unhealthy food is the key factor for the influence in children's choices. So Mongolia has taken the proactive approach to address these challenges. So therefore, the Mongolia has developed the legal frameworks to protect the children from unhealthy diets. The key laws and programs include, as you can see on the screen, the law on the marketing. It is in 2002. A law on secondary school food production and the services. Law on the preparing and the serving meals in primary and secondary schools in 2019, and national program to support school food service in 2022. So these measures regulate how food is produced and consumed in schools, ensuring the healthier options. However, the only one law directly regulates the harmful food marketing, which is the law on the food for the infants and young children, which was adopted in 2017. Based on this, the Ministry of Health approved the packaging and the labeling regulation on the baby formula and the complementary food for the infants and young children. And this was the critical step to the restricting inappropriate marketing targeting to the infant and young children. Next slide. The law on the food for the infants and young children has 5 main articles, with the Article 3 on marketing being the most important, and it prohibits the marketing tied to the sales promotion, marketing inside or near health facility, and sponsorship for the healthcare workers, researchers, and nutritionists, and the donations or the low-cost supplies to the healthcare or social institutions, such as the orphanage. So this closed the common loopholes companies use to influence parents and children. For example, the distributing free samples in Mongolia. Next slide. So for the supporting the policies and the guidelines, Mongolia has also adopted the several supporting policies and the guidelines. The most important is the list of foods prohibited for the sale close to the secondary school locations, which was adopted in 2020. And which protects the school children from the easy access to the unhealthy foods. And also, as you can see, the other measures include the guideline for the placing the calories and nutrients labeling in front of the food packaging, which was adopted in 2017, and procedure on the advertisement. Regulation aimed at the children was adopted 2019, and procedure on the activities for the food containers, packaging and labeling inspection board, which was adopted in 2019, and the guideline for the online monitoring system of the adolescents' health. And together, these measures strengthen the school food environment and making the healthier choices more accessible for the children. Next slide. So for the food labeling standards are really essential. The Mongolia's introduced the national standards, which is MNS 6648 2016, which improves the transparency, helps families make healthier decisions, and they strengthen the enforcement. And the parents can now easily read the labels and understand the nutritional information to supporting the healthier diets in children. The next slide. Despite the progress, we face several challenges. The first one is the insufficient monitoring, and many violations go unnoticed right now. And the second one is the outdated laws, which is the current regulation don't fully cover the digital marketing, including the social media. Of course, the social media is increasing in every country, and that's the one of the challenge. And the third one is the limited efforts from the businesses. Some companies has actually don't comply to fully comply. And the last one, that's not the last, and the fourth one is the inadequate cross-sectoral cooperation, which is like limited coordination between the government agency and also the non-government organization. So to address this, the Mongolia has taken some other steps. Actually, so we are started to developing the AI monitoring, and which is a platform and mobile application to track online violation. And next, the updating legislation, the new regulation will cover. As I said before, one of the really good thing is we have a law on the infant and the young children's law. We are also working for the improving the new regulation, and the next one is the strengthening the collaboration, which is the improving the coordination between the government agency and NGOs, also some business and civil society. And also we are improving raising the awareness, and which is really important. We are doing some campaigns for the parents and children, teachers, and the public to support child health. And also, actually, the government has adopted the action plan, which has the healthy and safe school, which is actually under the health promoting school policy. And according to this action plan, is some of the areas is covered for the improving the healthy diet in the children at the school. And these combined efforts aim to create a comprehensive system to protecting children harmful food marketing in Mongolia. Next slide. Yeah, that's the last slide. In conclusion, the Mongolia's experience shows the government-led mandatory policies are necessary and achievable to protect children from the harmful food marketing. And while challenges remain, our progress offers the lessons for other countries to facing the similar issues. And thank you for your attention, and I look forward to our discussion. Thank you.
Thank you so much. Thank you so much, Dr. Bienbabdu. You stated really, really well. Mandatory policies are necessary to protect children. So thank you so much for providing your valuable insights into the feasibility of mandatory approaches to regulate the marketing of breast milk substitute and unhealthy foods in schools. And we also look forward to hearing more about Mongolia's innovative ideas of solutions, especially on monitoring using AI to strengthen the policy implementation. Thank you again. Please stay with us too, if you can. Okay, now let's move to the last country for today's sharing. We're delighted to have Ms. Rachel Tso with us today. Rachel will share with us Singapore's experience with the NutriGrade, which is a front packaging system, and which is also an integrated policy approach that mandates restrictions on advertising grade D beverages. So she will tell us how monitoring and evaluation support the success of food marketing restrictions in Singapore. And Rachel is a senior manager at Singapore's Health Promotion Board, focusing on maternal and child health. She is a trained dietitian with experience in clinical care and nutrition research. Rachel, please.
Okay, thank you for the kind introduction and invitation to be here today. Good day, everyone, and good morning from Singapore. So I'm Rachel from Singapore's Health Promotion Board. Just to share a little bit about HPB, we are a statutory board under the Ministry of Health, established in 2001 as a national agency driving health promotion and disease prevention. I'm from the Policy and Strategy Development team, where my own area of work focuses on maternal and child health. So today I'll be sharing how monitoring and evaluation support the success of food marketing restrictions in Singapore. Next slide, please. First, I'll share an overview of the process of developing a NutriGrade system for beverages, followed by how the progress has been since implementing mandatory advertising prohibitions, and finally, the expansion of NutriGrade and overall lessons that we learned along the way. Next slide, please. So diabetes is a major public health issue in Singapore. Looking at the left, in 2014, over 400,000, or about 1 in 10 adults had diabetes, with numbers expected to more than double by 2050. Singapore had one of the highest prevalences among high-income countries, and in 2016, the government declared a war on diabetes. High sugar intake was identified as a key contributor, with over half from sugar-sweetened beverages. And of these, 64% were prepackaged drinks, such as ready-to-drink beverages in bottles, cans, packets, cartons, fountain drinks, and those needing dilutions like cordials and concentrates. And despite existing education and promotion efforts, sugar levels remain high, prompting further action to reduce sugar intake and combat diabetes. So we look at the middle. In late 2022, Singapore implemented NutriGrade, which introduced a few things: mandatory nutrition labels, front of pack grading, as you can see in the top right, the colorful A to D grading there, and advertising bans. So the measures were first applied to prepackaged beverages, then extended to freshly prepared drinks like bubble tea, brewed coffee and tea, and fresh juices sold at restaurants, cafes, takeaway kiosks, and food courts. Members of the public, experts, and industry stakeholders were extensively consulted in the development process, which I'll share a bit more in the next slide. So again, still looking at the middle, allow me to share about the NutriGrade system. There are 4 color-coded grades based on thresholds for both sugar and saturated fat. So grade A is in green with the lowest sugar and saturated fat thresholds, while grade D with the highest thresholds is in red. Now, saturated fat was included as a key nutrient of concern alongside sugar in drinks, and also to reduce the risk of substituting sugar with saturated fat to maintain the mouthfeel when industry reformulates the beverages to achieve better grades, which would undermine health outcomes. So NutriGrade is mandatory for grades C and D, but voluntary for A and B. Sugar content must also be shown clearly as a percentage, for example, 12% sugar, to enable consumers to compare levels across drinks in the same grade and make more informed choices. So on advertising, if we look at the right side of the slide, so advertisements related to grade D drinks are prohibited across all platforms, except in certain situations, such as point of sale materials in physical and online stores. So any grade D drinks in these point of sale instances must be prominently labeled that they are grade D. Okay, next slide, please. In developing NutriGrade, extensive stakeholder consultations were conducted with the public, experts, and industry to ensure the regulatory measures would be both effective and feasible. So looking at the left, from December 2018 to January 2019, stakeholders were consulted on possible measures for sugar-sweetened beverages. And based on these findings, in October 2019, going over to the next box, it was decided that labeling and advertising requirements would be introduced for prepackaged beverages. Consumer studies, you look at the bottom there, were also carried out to test nutrition label design, such as what would be most readable and understandable, while experts provided input on the grading system. And in December 2019, a second round of consultations engaged industry on the feasibility of implementing the proposed specifications. This was followed by the announcement of details of the nutrition label and grading system in Parliament, the WTO notification, consultation on draft regulations, and publication in the Gazette before measures took effect in 2022. Next slide, please. Okay, so the monitoring and evaluation process of Nutrigrade focuses on three main aspects. Firstly, ensuring grade C and D products are labeled. Secondly, Nutrigrade labeling on front of pack is accurate in terms of grade and percentage sugar. And thirdly, that advertised products do not feature grade D beverages. So if we look at the left side on physical checks, monitoring is done periodically at physical stores and online channels to verify the grade of products and ensure any featured grade D products, like on wobblers or in-store posters, carry the label. If we look on the right side, the social media space is also monitored for advertisements of grade D beverages. So towards the bottom there, if products are found to be grade D and violate the ad guidelines, cases are referred to the Ministry of Health to follow up with the company, such as advising rectification, warnings, and fines. So HPB does the monitoring and MOH does the enforcement. Okay, next slide, please. So how effective has Nutrigrade been? It's actually been quite effective in spurring industry to reformulate their products to be lower in sugar and saturated fat and shifted consumer preferences as well. So we have two data points here, 2017 and 2023. So from this time period, the proportion of drinks graded A and B by sales volume increased. We see the green increased from 37 to 69%. So this is the proportion of drinks graded A and B. And then in the orange there, grade C and D drinks during this time period dropped from 63 to 31%. So this provides evidence that suggests consumers are switching to healthier options based on what they purchase. And if we look at the bottom there, the overall market median sugar has decreased. And about 60% of F&B outlets serve drinks with less sugar as the default option. Okay, it's just next slide, please. Okay, so finally, I'll share how Nutrigrade is in the process of being extended to sodium and saturated fat and close with some overall lessons learned. So while efforts to bring down diabetes rates have been generally successful through a lot of hard work and a whole of society approach, diabetes has actually since stabilized. And the attention is on hypertension and hyperlipidemia, which remain high. To address this, from mid-2027, Nutrigrade labeling and advertising restrictions will be extended to key sources of sodium and saturated fat, such as pre-packed salt, sauces, seasonings, instant noodles, and cooking oils. Products rated D with the highest levels of sodium, sugar, and saturated fat cannot be advertised. If we look at the right side, the Nutrigrade label will be updated to show the nutrient, the ingredient of concern that results in a product's final grade to better help consumers understand the basis of the grade. So for example, if a product's sodium gives it a C, but saturated fat gives it D, the final grade will be D. And saturated fat will be named on the label along with the percentage of saturated fat in the product. So finally, many lessons were learned throughout the process of Nutrigrade development. Some key ones are engaging early and widely with media platforms. Although ad bans are usually imposed on the advertisers who commission the ad, it's important to engage the media platforms as well, since they're important stakeholders in ensuring compliance. And next, closely involving stakeholders was important. This is also related to the previous point. So to aid implementation to Nutrigrade regulations, guidance and resources for industry were available early, along with engagement. So actually, in the development of Nutrigrade sodium, more than 7,000 industry and expert stakeholders were consulted, as well as the public. And finally, the local context was considered when imposing ad restrictions. For Singapore, due to children's media exposure spreading across different time slots and platforms, a full ban was more effective than time or channel-specific restrictions done in other countries. And that concludes my sharing for today. Thank you very much for your time, and I welcome any questions.
Thank you so much, Rachel. So Singapore's experience of using evidence and careful WTO preparation highlights how governments can safeguard sovereignty while advancing front-of-pack labeling policy and stronger food marketing restrictions as well. Thank you again for sharing, Rachel. So today we ran into some unexpected technical issues with not able to share sound on Zoom. So able to play the presentation by Dr. Catherine Engelhardt from headquarters, but my colleague William will try to go through her presentation quickly and only highlight some key points from her presentation. William, if you can share the slides, IT.
Okay, thanks, C. I will try my best to summarize what Catherine from HQ have presented. Sorry for the inconvenience and the technical issue that we encounter. So, next slide. Okay, so in terms of the global commitment, I would like to remind all of you again, the global nutrition target and also NCD targets, there are commitments by the member states to reduce all form of malnutrition. And then there is also the extensions of the global nutrition target in this year that extended to the year of 2030. So as you can see here, the WHO dietary guideline on the left. Okay. So this is relating to the harmful marketing of product, breast milk substitute, complementary food, and also food and non-alcoholic beverages. That is the thing that we are looking at today. So next slide, please. As you can see, we have international code that kind of like protect us for more than decades. And we are emphasizing now that is milk for children 0 to less than 36 months, and also includes those for milks, growing up milks, and feeding bottle, etc., as shown on the screen. The net code is basically summarizing the scope pretty well. Next slide, please. And this further give you guidance on the implementation manual. And in terms of the commercial foods for the complementary feedings, we have 2 regions from the Euro and CRO that have the nutrient profiling system or model on this area. Next slide, please. This food marketing journey doesn't just come now, but it has been in 2010 that we have endorsed the WHA resolution on this area, and subsequently there are more policy or resolutions approved. But unfortunately, country action remain insufficient. Next slide, please. So if we would like to give you an example, what could be the best country? Unfortunately, they are always not a good country, but what we can summarize to you is those countries that have kind of like adopt some of the scope relating to the policy on the food marketing, as you can see from the screen. For example, the Canada and Quebec, the subnational level, up to the level of Chile, Peru, for example. Next slide, please. So as you can see here, I think Prof. Catherine just now from Deakin already summarized to you. Next slide, please, on the evidence. And we have now the WHO guideline. Next slide, please. Basically, we are proud to say that there are evidence looking at policy should be mandatory, protecting children of all ages using government-led nutrient profiling model, NPM, be comprehensive, and restrict power of the food marketing. Next slide, please. And this is another publications from the core joint of WHO and UNICEF, looking at the lens of a children's rights perspective. Next slide, please. While we are talking about traditional marketing, it's also very worrying to look at digital marketing. As you can see that they are more engaging, either it's through hashtags like and so on. Next slide, please. And these are just a summary of the tactics. Next slide, please. And we encourage you to look at this webinar that have been done in the HQ. Next slide, please. And this is example of the country that are available. Next slide, please. This is on digital marketing, and we have already published one particular guideline on digital marketing. With this, next slide, please. With thanks to our HQ colleague, Dr. Larry, and also Elizabeth, and also particularly Dr. Catherine. Over to you, C.
Thank you so much, William, for summarizing in 5 minutes. Okay, colleagues, now let me invite back our country speakers and our 2 experts back and for a quick discussion. Let's see if there's Q&A in the session, in the Q&A box. Let me just, if none, let me just ask this very important question. I think a lot of countries are dealing with this challenge. So let me just ask this to all panelists. So how do we overcome the interference from food and formula companies and industries when we design, enact, and implement policies to protect our children from harmful effect of food marketing? So anyone want to jump in, get us started first?
I can. I think it's certainly not an easy task. It is, you know, where the food and the advertising and the media industries are very powerful. And I think we need to have a strategic and a coordinated approach to countering the arguments that they make around the need for these policies. So I think the gathering and communicating evidence on the need for the policy is really important to help to shape that policy debate. I also think that we have quite good evidence internationally, potentially not at every local area, every local country level, but international evidence is very strong on the need to take action and very clear guidance now from WHO headquarters as well as from at the regional level. But what we are needing, the missing bit, I think, is that groundswell of support from civil society to really call on governments to take that action. And so I really do think that strengthening and galvanizing civil society support for the policy is really critical to apply pressure to policymakers to take action. We know what to do and how to do it, but we just need to increase the political will to take action.
Great, Bridget. Thank you so much. Anyone else want to chime in here? So Professor Bridget Kelly talked about a collaboration and the importance of the voice of civil society. Anyone else want to add any point?
If I could add, I think being prepared is really important, and that's what the operational manual helps countries to do, to really have the evidence at hand, understand the potential arguments that industry will put up, and having counterpoints to address those. They'll all be in the operational manual, but also having a transparent process, so communicating when and how industry is engaged. And of course, governments around the world do have to engage industry, but they don't need to be part of the decision-making process. So they can be there to be consulted with, but not at the decision-making table.
Thank you for that important point, Catherine. I just want to see Rachel or Ms. Atate and the speaker from Mongolia. Any point you want to add?
May I, ma'am?
Please, yes, please.
Yeah, I think also establishing conflict of interest safeguards would assist, because often industries gain influence through involving themselves in policy spaces, government policy spaces. Say, for instance, offering funding for sponsorships or partnerships. So I think governments ought to establish and implement very clear conflict of interest policies, especially for health and nutrition. Thank you.
Thank you so much. And we can actually learn a lot from tobacco control in this area, I believe. Okay, anyone else? Rachel?
Yeah, I can share from Singapore's experience. I shared a little bit on it earlier, but agreed it's a it's definitely a challenging issue. What we found helpful in our local context was, again, that engagement early and broadly with stakeholders across, the industry, experts, and media platforms, especially the industry as well, who indeed are very powerful. We always anchor discussions back to the core intent of the policy and whatever we do. For example, the public health purpose of tackling diabetes, so that commercial interests don't override health outcomes. We also do this alongside wide and regular consumer education efforts. We have ongoing public campaigns such as about Nutrigrade, so consumers are also well informed, and they can possibly exert pressure on industry as well. And we see this with receiving regular feedback when people write to us about certain products that may lack nutrition information, or they may query the grade of products they see or purchase. So consumers here are actually quite aware of the issue and the Nutrigrade measures, and maybe even possibly they write to the companies themselves to put the correct grade on the products. But yeah, I mean, it's really informing industry early and throughout the policy development, allowing sufficient time for them to take the measures to comply. Because no one likes surprises or not being consulted, and not involving them would definitely risk resistance and poor uptake.
That's a good point, Rachel. Thank you. So the consumer education is another important piece. So Dr. Bien Badu, yes.
Yeah. So so in Mongolia, I also introduced the actions in Mongolia, and so from me, so the most important is actually, so in Mongolia we have a law which is the strongest part for the policy, and we need the public education and awareness campaign is really important for that. Yeah. And also, of course, the food is prohibited, but that's been dissolved. Still dissolved Mongolia, and also, so we have the law, but the law is still not working some area, and for this, so we have to getting some education and giving some awareness about it to the population, and I think that's.
Thank you, Dr. Bien Badu, and thank you all speakers for your valuable points. I would love to stay here forever, to talk about this topic, but we're running out of time and we're already 6 minutes behind schedule. So I just want to say one more time, thank you so much for the participants and for joining us today, and for our speakers from our 2 experts, and then from countries, Mongolia, Singapore, and Fiji. And finally, I just want to say one more time, we're in the final stage of publishing the operational manual for the Regional Action Framework on protecting children from the harmful impact of food marketing in the Western Pacific. And we really look forward to sharing it with you in the coming weeks, and hope it will support your ongoing effort to address the challenges of food marketing. And we invite all the participants to give you your feedback. Please take a few minutes to complete this very short, I promise, survey, and will help us do better. And I just want to say once again, thank you so much, and good luck with your great effort in this very important area of work. And let's keep encouraging each other, and stay tuned. We'll be back for another webinar, hopefully in the near future. Thank you, everyone. Take care.
Thank you.